Good morning, everyone. Welcome to today's session. I'm excited to introduce our topic, Prometric MCQ 2025, Must Know for Pediatric Nursing. Today, we'll be going over key multiple-choice questions that are essential for your preparation. We'll cover important concepts and tips to help you succeed in your exams. Let's get started and make this session both informative and engaging. Let's take a closer look at pediatric dehydration assessment. This is a key concept because accurately identifying dehydration in children can be quite challenging, but is absolutely essential for effective treatment. When we assess dehydration, we're really looking at a combination of clinical signs and symptoms that can tell us how much fluid loss has occurred. It's important to remember that children often present differently from adults, so our assessment needs to be tailored to their unique physiology. Key points include evaluating their hydration status through physical examination, things like their skin turgor, mucous membranes, eye appearance, and capillary refill time. Additionally, monitoring their vital signs, such as heart rate and blood pressure, can give us important clues. The overall goal here is to determine the severity of dehydration, whether it's mild, moderate, or severe, so we can decide on the most appropriate intervention. Connecting this to the broader theme of pediatric care, accurate assessment is the foundation of effective management. The sooner we recognize signs of dehydration, the better we can prevent complications and ensure the child recovers quickly. So, always remember that a thorough and careful assessment is your first step in providing optimal care for dehydrated children. Dehydration can be tricky to assess, but understanding the best method is crucial in managing it effectively. Now, when we think about assessing dehydration, several signs come to mind, but not all are equally reliable. For example, pulse rate can increase with dehydration, but it's also influenced by other factors like anxiety or medications. Skin turgor, which is how quickly the skin returns to normal after being pinched, is often used, but it can be less reliable in elderly patients or those with certain skin conditions. Urine output, on the other hand, is a very good indicator. Decreased urine output typically signals dehydration because the body is conserving water. And blood pressure. While it can drop with severe dehydration, it may not always be sensitive enough on its own. So, among these options, urine output tends to be the most straightforward and reliable measure for assessing dehydration. Remember, no single sign is perfect. It's always best to look at the whole clinical picture. This focus on urine output ties directly into our overall theme of accurate assessment for effective treatment. Now, let's talk about urine output, which is a crucial indicator of kidney function and overall fluid balance. When assessing a patient's status, paying attention to urine output helps us understand how well their kidneys are working and whether they are maintaining proper hydration. A normal urine output is generally about 0.5 to 1 milliliter per kilogram of body weight per hour. If the output drops significantly below that, it could suggest dehydration, kidney injury, or other underlying issues. Conversely, very high urine output might indicate conditions like diabetes insipidus or response to certain medications. Monitoring urine output is especially important in critically ill patients, as it provides real-time clues about their hemodynamic stability and kidney health. It's one of those key signs that, when combined with other vital signs and lab results, paints a comprehensive picture of the patient's condition. So, in summary, urine output is not just about how much they're passing. It's a vital sign that reflects the state of their fluid balance and kidney function, and keeping a close eye on it helps us make timely and informed clinical decisions. Urine output is actually the most reliable indicator we have for assessing hydration status in children. It gives us direct insight into how well the kidneys are functioning, specifically reflecting renal perfusion and intravascular volume. This is more accurate than other signs we often look at, like pulse, skin turgor, or blood pressure. For example, blood pressure changes tend to occur quite late, so waiting for BP to drop might mean missing an early sign of dehydration. Skin turgor, on the other hand, can vary quite a bit depending on the child's age, making it less consistent. and pulse rate can increase due to many other reasons, not just dehydration, so it's not always a reliable standalone indicator. So overall, paying close attention to urine output helps us get a more precise picture of the child's hydration status, allowing us to intervene more effectively and promptly. This underscores the importance of monitoring urine output carefully in our assessments.